From the USA now, I have the pleasure of introducing Dr. Bonni Goldstein with a talk titled Medical Cannabis Treatment for Adults and Children. Dr. Bonni Goldstein is a native of New Jersey. After attaining her education, she was a clinical instructor in pediatrics at USC School of Medicine in Los Angeles, emergency transport attending physician at Children's Hospital Los Angeles, and emergency medicine attending physician in the Pediatric Emergency Department at Los Angeles County USC Medical Center. In 2008, Dr. Goldstein developed an interest in the science of medical cannabis after witnessing its beneficial effects in an ill friend. Since then, she has evaluated thousands of patients for use of medical cannabis with a focus and an interest in treating pediatric epilepsy, autism, and cancer. Dr. Goldstein has given numerous lectures as a patient support programs. And Dr. Goldstein is the owner and medical director of Cannacenters, a medical practice devoted to educating patients about the use of cannabis for serious and chronic medical conditions, and the medical director for weedmaps.com. She is a member for the International Association of Cannabis as Medicine, the International Cannabinoid Research Society, and the Society of Cannabis Clinicians. Ladies and gentlemen, it gives me great pleasure to introduce Dr. Bonni Goldstein.
All right, thank you so much for inviting me, Lucy, and United in Compassion. It's really very exciting to come all the way to Australia to share my information and to hopefully help people understand that medical cannabis is a medicine. I kind of get from the feeling of today that I'm preaching to the choir a little bit, but anybody who's had any doubts, you must believe that we're not all crazy, that this is medicine. It was medicine for a very long time, and only for a short time over the last few thousand years it was turned into a drug of abuse, and that's where the mistake was made. And now we're spending all this time, energy, money, effort trying to turn that mistake around. Propaganda is not the way to go. Fear is certainly not the way to go. Education is the way to go. And before I get started, I want to say I am the mother of a 15-year-old boy. I've been in medical practice for a medical physician for 25 years, and I've learned that education, as Rob said, is the only way that we can move this forward. We must educate ourselves, and then we must educate others. We cannot use fear tactics, and we cannot treat this as a drug of abuse. All drugs can be abused. When I worked in the pediatric emergency department, I saw all kinds of things being abused by teenagers. Teenagers make stupid decisions. That's what they do. And we have to allow that. But if I had to pick one thing for my child to quote, abuse, it would certainly be cannabis. And because I know he would never end up in an ER, and I wouldn't have to worry about claiming his body at the morgue. I saw so many teenagers come in intoxicated with alcohol and prescription drugs that I started dreading Friday night shifts, because I knew that I was going to have to call a parent and say, sorry, we have your child in the ICU because they went to a party and they're not coming home tonight, and hopefully they're going to wake up tomorrow. So this is not cannabis. Just has to be, we have to stop looking at it as a narcotic. We have to stop looking at it as a drug of abuse. It is medicine. This is my favorite slide of all, and I woke up one day to this text message. This is Isaiah, and he's one of my patients, and his mother decided to take a piece of cardboard and put a note on it and post it on Facebook and send it to me as well. And it says, hi, my name is Isaiah. I'm 8 years old. I have intractable epilepsy. No pharmaceutical has ever stopped my seizures ever. I was having seizures every 30 to 45 seconds. Today, February 2nd of this year, 2016, I am 1 month pharmaceutical free and 6 months seizure free. Big thanks to God, Realm of Caring, Miriam's Hope, Dr. G, Hashtag cannabis is medicine, hashtag seizures suck, cannabis oil gave me back my son. What's interesting about Isaiah is Isaiah has an aunt and an uncle who both have intractable seizure disorders. His uncle is severely mentally handicapped from the seizures never being controlled. His mother saw Isaiah's future and she refused to accept that. And now I can just happily say Isaiah has 3 more months added on to pharmaceutical-free and seizure-free. And he's in school, he's succeeding, he's doing well, he's learning. And there's no reason to make one more child wait for an opportunity. It may not be the option, and it's not like it turns around in one day. It's a process when you're using cannabis, but it absolutely 100% needs to be an option, and it really should be an option now. So in my practice, I take care of both adults and children, and as you can see, the most common diagnoses we see with adults, really, it's almost everything. As Dr. Hergenrather said, we see so many different things, and remember that's because where the receptors are located, it affects just about every physiologic system in your body. No question that chronic pain is the #1 thing that we're seeing in my office, along with sleep disorders, psychiatric illness, and so on. Where I live and practice, which is in Los Angeles, it's a little different than Northern California. Southern California still has a lot of issues with acceptance. It's surprising it's the same state, but there's really, if you've ever been there or you know anybody from there, they'll tell you Northern California and Southern California really should be different states with the way they act. But in general, the word's out, and cannabis is a real option for patients who have any of these conditions, and so many people are finding that it really works quite well. Now, for my pediatric patients, it is somewhat limited to these disorders: treatment-resistant epilepsy, autism, advanced cancer. I have a handful of patients with psychiatric disorders, and then I'm also seeing something new in my practice. Just in the last few months, I've had 3 patients come in with PANS or PANDAS, which is a type of pediatric autoimmune disease. And what's interesting about this particular condition is that it's not really fully defined, and it's just becoming something that is newly diagnosed, and so, or at least doctors are newly diagnosing it, and I suspect that we're going to see more patients who have PANDAS. A lot of the science has already been discussed, and so I'm going to try to limit this to really the clinical aspects for the most part. And remember, with cannabis treatment, we're talking about over 400 compounds in the cannabis plant versus single molecule pharmaceuticals, so it's going to work differently. It is a different type of medicine. The main compounds, phytocannabinoids, there's over 100 that have been described, and we know the focus on research has been mostly THC and CBD, but certainly all the other cannabinoids we're going to see in more and more strains available with higher amounts of other cannabinoids as well. Terpenoids, which have been discussed, basically the essential oils that have medicinal properties. Entourage effect and synergy, we've discussed that already, but it's certainly the reason that I encourage patients to use full spectrum plant as opposed to single molecule plant compounds. Excellent safety profile, no fatalities. Again, I worked in pediatric emergency medicine for about 13 years in busy inner city Los Angeles with 60,000 pediatric emergency room visits, and I did not see one cannabis patient problem in all of that time. What's interesting about cannabis is I often get asked, what strain do you recommend, for instance, for Parkinson's disease? What strain do you recommend for ADD? And it really depends on the patient's overall condition. I ask lots of questions when I meet with patients because I'm trying to get a sense of what the patient is looking for and really what the problems are. Because remember, you can have 2 patients with fibromyalgia. Sure, you check off the same box, but they may have very different problems. One patient says, well, my fibromyalgia is not really causing me that much trouble because I've been sleeping okay because I figured out how to do that, but I have pain issues. And then somebody else may have the exact opposite. So really, you want to find an individual approach, and part of that too is because the response is individual. I have patients with the same diagnoses who respond very differently to the same dose, the same strain, the same ratio of CBD to THC. So part of this is that it is not one size fits all, and we really can't assume that. In general with cannabis, we jokingly say start low and go slow, but really what that means is you start low dose and you titrate up. Again, everybody's dose is different. And I believe it was Dr. Abrams from UCSF who coined the term patient-determined self-titrating dose. Now that's a little bit different for epilepsy and also for some of my cancer patients, but in general, patients get to decide. You can find a dose that will work for you, a strain that will work for you. Will be very individual. As I said, someone with the same condition, same diagnosis may have a very different response to your result. Now the endocannabinoid system has been discussed, and so I don't want to go over it too much, but again, the big key here is your endocannabinoid tone, as Dr. Russo talked about, is individual to you. I like to explain this to my patients in a way that really they can understand it. Remember, you have a certain spot where your endocannabinoid system lives, and if you're under or over, it can lead to illness. And it's usually, for many, an endocannabinoid deficiency. I liken that to a thyroid condition. If you have low thyroid, what does your doctor replace it with? Thyroid medication, right? So if you meet somebody or you yourself have disease and you have not found the answer for it, it's certainly possible, and when we look at the list of conditions that are considered possible endocannabinoid deficient conditions, if you're not using endocannabinoid, you're treating all around it and you're missing the target. So we have to remember that you can look at the person next to you and may not look ill, but they may very well have an endocannabinoid deficiency. And that may be on a scale. Some people may be just a slight amount, and other people may be more. I have a lot of patients who use cannabis and find that they do not really get high from a certain amount of THC. They have likely found their sweet spot where their endocannabinoid deficiency is actually, now they're not deficient anymore, they're out of balance, and it's working beautifully for them. The same dose for you might make you too stoned or might not do anything. Everybody is individual in this. Now, medical cannabis patients for adults, when my patients come in, they have to fill out a form that details their history, what they've tried, whether or not they've used cannabis before. I do find it's a little bit different between patients, what we call cannabis naive, never used cannabis ever, or patients who are experienced. And then there's some people in there who say, well, you know, I smoked it back in the day in the 60s or 70s and I haven't touched it since. Once I have an idea of how they're approaching cannabis, and whether or not, and I also say to patients, well, when you did smoke it back in the day, what did you find? Oh, I used to sleep great. Or, oh, I hated it, it made me anxious. That gives me some idea of where to go with their treatment, because if they're telling me that they're anxious from it, it's quite possible that they just overdid it in a recreational setting, but it's also possible that they don't do very well with high doses or high amounts of THC. Method of delivery, as Dr. Hergenrather went over, is very important. I ask patients, what sounds good to you? It may not be where we end up. You may say to me, I'm absolutely not going to inhale it. I only want to eat it, but when you eat it, you may find it's just too strong. You can't dial in the dose, and then you may want to switch over to inhaling it. I have some patients that have come in who have cancer. They're on very, very strong chemotherapies. In fact, I just recently had a patient came in and she had a little baggie and she opened it up and dumped it on my desk, and it was all of these edible products that someone had given her out of compassion, and she said, none of it works. Well, she's likely not absorbing any of it. The chemotherapy was destroying her gut. She had lost about 50 pounds. She wasn't able to really eat anything, and I just don't think she had any absorption. That is not the way for this particular patient to use cannabis. So delivery method you must have options. People have to have different ways to take it that will work, again, best for them. In my practice, a majority of patients are using either inhalation, smoking, vaporizing, or sublingual tinctures that have become readily available, and then a small percentage of patients do find edibles to help. Again, edible, because of the effect through the liver, can be very difficult to dose, although some patients do figure out dosing. Effects of CBD and THC. It's important to know what the effects of CBD and what the effects of THC, and that's already been discussed today. But again, I find for most of my patients, some combination thereof is very helpful. In California, there are so many products available now that if you really don't have an idea of what you're doing, it is completely and totally intimidating. It's like walking into the vitamin shop and seeing that big wall of vitamins and saying, oh no, I don't know what to get. And you turn around and walk out without anything. So what I've done is I kind of came up with this three-tiered approach to patients to explain to them 3 different ways that cannabis are available in California, and hopefully that would be something that would be available here. And this way you're going in with an approach of what sounds, a patient can say what sounds good to them, where they want to start, of course being flexible to shift between these 3 different categories may be required in order to find the answer. So of course THC-rich medicine, that's the medicine that most people have tried in a recreational setting. The THC is the dominant effect. And I always say it's not only recreational. It really bothers me when people say THC is recreational only. Absolutely not. I've been doing this for a long time, and for the first 5 years of my practice, CBD products were very, very rare to find. Most of my patients who were getting good results were getting good results with THC. They just were responsible adult users and patients. The medical dose can be found. If you take too much, okay, back up. You don't have to stay there. It's very simple. You titrate up. You may say, oh, I overdid it, and you back right back down to find that dose that works for you. For most of my patients, they're using THC-rich medicine at nighttime because they want to have a functional day, although there are many patients who do use it during the daytime as well. My caveat is just do everybody a favor. Don't drive if you're feeling that the psychoactive effects. Be responsible like you would with any other medication that has psychoactivity. Most of my patients using THC-rich medicine, this is just some of the things: sleep, pain, nausea, mood, and appetite. Those are the things that some patients say THC-rich medicine works the best for. And then what I've done for my patients is I've broken down high ratio CBD to THC and low ratio CBD to THC so that they can understand that with the lower ratio, there's a combination of effects, and with the higher ratio, there's still combination, but it's more of a CBD dominant. And what that allows for is for a patient to use something that may be not all THC, low CBD, but something the opposite way that allows them to still get a range from, let's say 27 to 1 is about the highest we see on the market in California, all the way down to 10 to 1. You're still getting dominant CBD effects, but getting some THC effects as well, but you're really limiting the psychoactivity for most patients. Again, it's individual, but for most of my patients, anything over 10 to 1, they just don't feel the high effects. And for many of them, it's not sedating, and it allows them to use it during the daytime to control symptoms and also to still be functional. For many patients, it's for pain, inflammation, mood, and certainly seizure disorders. The lower ratio CBD to THC, again, it's a combination effect. It may or may not be psychoactive. It depends on who you are. It depends on if you have some tolerance to THC. It depends on if you're brand new to this. It also depends on how your brain responds. CBD will buffer some of the THC effects and lessen some of the psychoactivity. So again, depending on your response, that may work better for you. Pain, inflammation, mood, sleep, nausea. Certainly neuropathic pain appears to be in this category in terms of treating pain very effectively. The reason, again, why I did this kind of breakdown is so that patients can approach products that are labeled and tested and understand the effects that they may get from that. Now here's a case report of one of my patients, a 54-year-old female with diabetic neuropathy. She's one of my favorite patients. She comes to see me a couple times a year. She is a middle school counselor, and so she's very, very private about her cannabis use. She's had an 8-year history of adult onset diabetes with 6 years of nerve pain interfering with sleep, and she underwent a gastric bypass so that she was morbidly obese when I met her, and now she's actually quite thin. And she had significant weight loss, which resulted in the control of her glucose, but her neuropathy persisted, and that's how she ended up in my office. She's tried multiple different drugs, including gabapentin and opiates, and nothing seemed to work at all. Someone in her life gave her some cannabis before she came to my office, and she found complete relief of pain and much improved sleep. And so she wanted to be legal. She didn't want to risk her job or her situation. And so we started her, and I believe, by the way, that the product that she was using when she came in, it was just a cookie that someone had given her, so she wasn't really sure, but she told me that it made her a little buzzed and put her to sleep. So I was pretty sure it was a high THC product. But during the daytime, if she had pain, she would use, or she is using CBD to THC in a spray, and the ratio she's using is about a 25-to-1. And then she would also apply topical cannabis to her feet if they were bothering her, and she actually found that to be really take the edge off the pain, so she wasn't so focused on the pain and she was able to think about her job. Again, if she's having a good day and her pain, she doesn't have pain that day, she just skips it. She doesn't need to take it that day. At nighttime, she had decided to add in, after I taught her about CBD, which she had not heard of, she decided to try a low ratio CBD to THC edible, and it's a 1-to-1 ratio. She takes it about 8 or 9 o'clock at night, and she says that she gets about between 6 and 8 hours of undisturbed sleep, and her feet don't hurt in the morning when she wakes up, and she's really found that this has worked very well. She doesn't require medicine every night. She says there are some weeks that are good, some weeks that are bad, and she just uses as needed. But the important thing is she's gotten off all other pain and sleep medications that were prescribed to her. And now she's just doing diet controlled, so she's actually pharmaceutical free. Here's another case report of a patient, again, one of my favorite patients, a 26-year-old gal that came in, and she had onset of juvenile rheumatoid arthritis at the age of 15. And so I saw her at first at the age of 24. She had tremendous side effects with conventional medications, and actually what brought her into my office was she had a life-threatening allergic reaction to one of the medications, where she ended up in the ICU, and the family was told that she actually might not get out of the ICU. And so at that point they withdrew all once she survived, they withdrew all medications, and they came to me. But I will tell you, she is wheelchair bound. When I met her, she was very anxious and depressed. She has severe disability due to the pain and swelling. She was unable to go to school or take care of herself. And the really sad thing for her is she's the eldest sister of 4 sisters, and the other 3 are going to college, have boyfriends, have independent lives, are driving, and so on. And she was really the one that was kind of left at home. And I think it just really caused a lot of anxiety and depression for her. And when I first saw her, she was anti-cannabis. She was open to it after having so many people talk to her about it. But what we've done is we put her on very high dose, high ratio CBD to THC oil. She takes a ratio of about 27-to-1. She's taking upwards of 200 milligrams of CBD per day, and it's divided in every 8-hour doses. And it's worked tremendous for her. I mean, she has the hands of like a 70-year-old. They're completely contracted and swollen and deformed. And she texted me one day to tell me that she knew she was getting better when she was able to clip her own fingernails with the fingernail clipper, because she could actually use the device. Now, she does also use inhaled and sublingual THC-rich cannabis for breakthrough pain through mostly vaporizer, and then just recently switched to sublingual. And she's not taking any other medications. she and I email and text here and there, and I just had to steal her quote from a recent email. For so long I couldn't do anything. I'm living again. I feel like this is the medicine that I prayed for but didn't know existed. Finding cannabis was an answer to those prayers. And that's kind of amazing for her. She feels that she's gotten her life back. She started cooking. She's able to take a shower by herself, and these are all tremendous things for someone who has such severe disability. And then this is a very common story that I see. This is a 47-year-old construction worker. He's a dad of 2 children. He had a very severe injury at work where a very large piece of furniture that they were trying to take up some stairs fell on him, and he subsequently was diagnosed with a herniated lumbar disc. And he went through the typical conventional treatment: opiates, muscle relaxers, non-steroidals, physical therapy, and epidural injections, and he really did not get any relief. And he was reluctant to have surgery. So and it's funny because he comes from a family of cops, of policemen, and so he was very reluctant to come in and had a lot of questions. But he started using THC-rich cannabis before coming in, and he found relief. And he basically came in and said, I just want to be legal. I'm a law-abiding citizen. I just want to continue to be law-abiding. And so we did try CBD with him. He didn't find it to be effective for daytime use, and so he's really just using cannabis at night, THC-rich cannabis mostly. He says that if he's overdone it at work and he feels something flaring up, with my encouragement, he started adding some CBD at nighttime, and it appears that he doesn't get these full-blown kind of episodes where he can't get out of bed. He's able to kind of reduce the flare-up when he adds in CBD. He's also been using exercise and acupuncture, and he's also a patient of mine who's been able to stay off all medications at this point as well. Now, moving on to pediatric use, people often ask me, how do you prescribe or how do you recommend cannabis to children? These are not healthy children that are coming in to see me. Healthy children are at school and running around and doing wonderful things. The patients that are coming in to me are usually patients that have, of course, tried many other things. But there's scientific evidence now. We know, especially with seizure disorder, and starting to see some evidence in the literature for autism, that there is endocannabinoid system dysfunction. Again, if that's where the dysfunction is, that's what we should be treating. Again, cannabis has an excellent safety profile. In my pediatric patients, I see little to no side effects. We have to remember quality of life for these families. Even any little improvement is going to be better than where they are today. If they can get some improvement with cannabis, it may not be perfect, but it, again, without side effects, this is something that families have to have an option for. Certainly compassionate care and end of life for patients that are terminal. And then more recently in California, there is much better testing of products. There's way more products on the market. And by the way, in California, we kind of did it backwards. Voters voted this in, and then it was available. Many doctors resisted, and then some doctors became pioneers in this, and then certainly more doctors now are recommending it, or at least recommending patients to go see a doctor who will recommend it. But we didn't have tested products for the most part, and so you really didn't know what you were getting. And in general, it was still very safe. If something didn't work, you could go back and try something else. But we have regulations coming into effect in about a year and a half. Finally, that's 22 years after the law was passed. It's about time. But now what I tell patients is buy products that are labeled. Know what you're getting. There's no reason to buy anything that's not labeled, because for the most part, we can actually see now that there's no pesticides, no solvents, whether it was grown indoors or outdoors, what the potency is in terms of the THC and CBD. And so that's certainly enhanced my assurance that my pediatric patients are going to get products that are not going to be potentially bad for them. Now, I'm just going to go over the CBD use in epilepsy, because there's certainly a lot of interest and a lot of media attention to this. The literature back in the late 70s and in the 80s, there were 3 small trials, and there were some results that showed that this was helpful. It wasn't for everybody that was in these small groups. However, what was definitely found out was that CBD was very well tolerated, that there were little to no side effects, and that it certainly had some promise. And what's interesting is if you look, the last one there is 1985, and there wasn't really anything again until 2005, which is a tremendous, a long time without any movement forward. This was presented at the 2005 Congress on Cannabis and Cannabinoids in the Netherlands in 2005, and there was an open study of 18 pediatric patients with refractory seizure disorders. They found no side effects requiring CBD discontinuation. The majority saw at least a 25% improvement in seizures with low CBD doses, and all the CBD treated children had improvement in consciousness, and if they had spasticity, that was improved as well. This is a report in Epilepsy and Behavior in 2013. 2 Stanford doctors surveyed 19 patients using CBD-rich cannabis. This was the oil that was promoted or put on the map by Dr. Sanjay Gupta on the CNN special called Weed. And these families were using the Charlotte's Web strain that became very famous in California. As you can see, 13 of the children had Dravet syndrome, which, if you're not familiar with that, it's a genetic seizure disorder that has a very poor prognosis. 4 had Dusse syndrome, and 1 had Lennox-Gastaut, and 1 child with idiopathic, meaning unknown, epilepsy. The average number of anti-epileptic drugs tried was 12. It's fairly well known in the neurology literature that only about 50% of patients respond to the first anti-seizure medicine, and then the percentages drop after that. Only about 13% of patients respond to the second medicine, and then only somewhere between 1 and 4% respond to the third medicine. If you're trying 12 medicines, you can be pretty sure you have a treatment-resistant epilepsy, or at least conventional treatment-resistant epilepsy. In their survey, they found that 16 out of the 19 families reported a reduction in their child's seizure frequency while taking CBD-rich cannabis. And you can see the breakdown there. They had 2 kids become completely seizure-free. And remember, these are kids who are otherwise told intractable, treatment-resistant. 8 out of the 19 reported greater than 80% reduction, and 6 out of the 19 reported a 25 to 60% reduction. What's interesting is that the beneficial side effects: increased alertness, better mood, and better sleep. And who wouldn't take that? I have yet to hear that any anti-epileptic medication has those beneficial effects. And then adverse side effects included drowsiness and fatigue. Another report that came out of Colorado by Dr. Getty and Dr. Ma from Denver. This was presented at the American Epilepsy Society meeting at the end of 2013, and it's a small study, but it shows that 73% of the patients that took CBD oil had 98 to 100% reduction of seizures, and at 3 months, 45% were seizure-free. Those are excellent numbers. I don't know if these patients were handpicked for particular conditions. I wasn't able to find that information. Now, this is interesting. As you know, I think Dr. Russo talked about Epidiolex. This is a compound that is being currently provided in the United States for compassionate care trial, and is actually going into randomized trials right now. And some of the initial information that has come out is actually quite helpful. This is a report about CBD and drug interactions, and it's important that we have some of this information because we do know that CBD can be metabolized in the liver, where many of these other drugs can be metabolized. What this chart shows is, so the axis all the way to the left is the percent change in serum levels. The dark line that goes right through the middle is the baseline, meaning if we drew a drug level of one of the drugs listed at the bottom, the baseline would be at 0, And then after CBD was added to the regimen, another drug level was drawn and was charted. Either it went up or it went down, of course, without changing the dose of that particular drug. So in the very first yellow line that you see up and down, that's the drug called clobazam. The brand name is Onfi. Out of the 33 patients where they checked levels pre and post CBD treatment, as you can see the number 17 right above where it says clobazam, there were 17 patients that were on clobazam. And it's kind of confusing. The one dark line on the higher top shows the average. You can see that. But in general, you could see for some of these patients, the clobazam level was raised up after CBD was added. The level went sky high, and they reported as high as over 400% for one particular patient. And for other patients, it went down as low as almost 70 or 80%. So some of the information that can be gleaned from this is, if you'll see the fifth drug over that says lamotrigine, primarily most of the levels have dropped there. If you can see for phenobarb, primarily it's a little bit higher. Again, the cocktail that patients are on, medication cocktail that they're taking, can be can confuse all the variables. But what we're starting to see is that I know that when I add CBD to a child's regimen who is already on Onfi, I can tell the family, on average, Onfi is going to go up. Keep an eye out for side effects, because we don't normally check Onfi levels. But if I'm adding it to someone who's on Lamictal, I'm going to tell the family, if you start seeing more seizures, it's not the CBD causing the seizures. I mean, that is what we've added, but it likely is causing that Lamictal level to go down, and now your child may not be on enough CBD to cover, because we start low and go up slowly from there. So this information is very important. Here's another, this is a survey actually out of UCLA, and many of the patients that were in this survey are also my patients, because I get a lot of UCLA patients in my practice. They surveyed 117 parents of children with epilepsy who had administered whole plant CBD. This was not any specific products. The patients were using probably one of about 4 or 5 different suppliers for the oil. 85% of families reported seizure reduction. 14% reported complete seizure freedom. The average number of drugs that these children had been on prior to starting CBD was 8. And again, here are the side effects. 53% improved sleep, 71% improved alertness, 63% improved mood. And what's interesting is they listed increased appetite as a bad side effect, which for many families, they'll tell you they're very happy that their child's actually showing an interest in food. Another report out of the Epidiolex, and this is at the end of last year in 2015, they have their results for 261 patients who were treatment-resistant epilepsy. And again, what we're seeing is that CBD does appear to help control seizures for children. Over 47% in their trial had greater than 50% reduction of seizures. Remember, Epidiolex has no THC in it, and it has a very, very small percentage of other cannabinoids. It's primarily CBD. Very different from what my patients who come to see me use. But overall, they saw 9% seizure freedom and 13% in their Dravet patients, which is fantastic. And interestingly, and this is why we'll take any information that's being done in trials, is that what was found was if the child was on clobazam, they actually had an increased chance of getting seizure reduction. So clobazam co-therapy was associated with the higher rate of treatment, 57% versus 39%. I used to tell, people will come to me and tell me they hate clobazam, it makes their kids into zombies. And I think part of that is because if you're not getting seizure control, you're increasing the dose, and you get to a point where now the child's on such a high dose that you're basically shutting that child down. They're sleeping. I have one family that told me they moved their child from the bed to the couch to the stroller. She never really did anything, and she was on a very high dose of clobazam, and now that we've gotten it down, she's actually woken up. It never really changed the number of seizures she was having, and she's had very good success now with clobazam and with CBD, but we got it down to a dose where CBD and clobazam together seemed to work, and was able to minimize the negative impact of that particular drug for her. I have 2 patients Two other patients that are children with seizures, we weaned them off all drugs because they had a very good response, but were not seizure free. Once they were off everything, they did have a slight rise in their seizures, and we added back low dose Omphie, only in one case 5 milligrams, and another child only 2.5 milligrams at night, and they've had almost complete, I would say 99% cessation of seizures. So sometimes you can use combination therapy for these children who have very difficult epilepsy. What's interesting about this study, by the way, and I really should point this out, this was a side effects study in the United States to find out what are the side effects. And they ramped the doses up, and I should go back to this. As you can see in the first bullet point, they started at a low dose, I think around 2 milligrams per kilo per day, and they ramped it up to 25 milligrams per kilo per day, and that is about twice as high as I go in my families of the highest dose, and part of that is because of affordability. But really, what they were looking for was side effects, and these side effects listed here. I mean, it's hard to say what a parent said to me, but she said she would take explosive diarrhea all over her lap over another seizure because her child has had thousands and thousands. And so when you see these side effects, these are all things that for most people they can handle. And remember, these were on very high doses and may not be exactly what I just don't see these kind of side effects, which I'll get to. In general, they found that Epidiolex was overall tolerated well, and that currently as I mentioned, there's some randomized controlled studies that are starting. By the way, if you see one of the bullet points says convulsions as a side effect in a patient who already has convulsions, that's a little bit difficult, and that was really, there were multiple investigators in this, and some reported increased seizures as a side effect and some did not. So it's a little unclear as to whether or not it really does cause increased seizures, or if it's just because it's messing with the child's other medications. Now, how does CBD work as an anticonvulsant? And so it's interesting. THC, remember, works at the receptor site. It is monogamous to that receptor site. CBD has multiple sites of action. It works in many different places, as you can see here. Receptor-independent channels. It binds or blocks to non-cannabinoid receptors, modulating the flow of neurotransmitters. It modulates calcium channels. It will actually block the uptake of your natural endocannabinoid. If a patient has a seizure disorder because they are endocannabinoid deficient, but they may have some endocannabinoid, potentially CBD can help enhance their own natural endocannabinoids to participate in maintaining a balanced system. Certainly anti-inflammatory and neuroprotective and antioxidant effects at work here as well. So when CBD works, remember, it's not just at one place, it's working on multiple levels, and that may be why we are seeing so many benefits, especially in patients with epilepsy. Now, THC as an anticonvulsant is interesting. As Dr. Hergenrather mentioned, it's been known to work. I have a lot of adult patients that come in and they just want to be legal because they find cannabis is working. They just take a puff and they don't have any more seizures. It's hard to know for sure that that's what's working for them, but if they're not having seizures and that's what they attribute it to, and they're not having side effects, I'm certainly on board with that. There's conflicting results in animals. It's been shown to be both an anticonvulsant and a proconvulsant. What's interesting for some patients is they can develop tolerance, and it may have some, therefore, limited use for patients with severe seizure disorders. And if you're developing tolerance to the effects, you may not be able, you can't just keep ramping up on it because eventually you're probably going to have some side effects from a very high dose. Certainly with a developing brain, there's concerns for psychoactivity and for the effects on a developing brain. But again, as I mentioned earlier, the patients who are coming to me who are children are very sick. And we don't know what long-term multiple anticonvulsants are doing to their brain. I would put my bets on cannabis over any of those any day. So I talk to the families about their negative perception of THC, but I always tell them that may be one of the things that we're going to use in order to control seizures. Clinically, I found low doses of THC in a sublingual or sometimes through the G-tube or orally can be very helpful when weaning off other anticonvulsants. Remember, if you're getting a good result, once you start weaning, you may have rebound seizures or withdrawal seizures. And many of my families have found that they're using THC just for short term for a few weeks after they wean a dose, and they're able to get through that very difficult weaning period. One of the products that I like that's available from multiple suppliers is 10 milligrams of THC per 1 ml. This way, when you can measure very low doses, because some children are highly sensitive to low doses, you don't need a lot. So on a little 1 ml syringe, you can measure 0.1 ml. It's about equal to 4 drops, and that's about 1 milligram of this particular preparation. So it allows us to really titrate to see if that's what's going to work for these patients. It allows us to know exactly where that child, how much they're getting, and also to be able to repeat and not have to worry about what am I getting this month, last month. If it's 10 milligrams in 1 ml or close to that, we know that we can get very close consistency of medicine. What I have found with some patients, we have like a 27-to-1 or 25-to-1 ratio that many patients start with. Either Charlotte's Web strain, ACDC strain. There are some others in California, but those are the main two that most of my patients are using. Right now, and I'll tell you, just in the last 2 years, we went from 2 suppliers to about 8 suppliers. So, and they're all, pesticide-free, tested, solvent-free. There's a lot of CBD on the market that is still untested, so regulations will help. I'm going to go over what the requirements of a good product for a child is. But in general, now that there's 8 different strains and products available, the patients now have choices. If something doesn't work, they can try something else. Some of my patients, again, not only to get through the weaning off of anti-epileptics, but in adding low-dose THC to the CBD product that they're getting, remember that changes the ratio. And for some of those patients, we get to a very nice spot. I will tell you, I have a young man who had an onset of seizures at the age of 10, and he had 3 years of terrible, terrible, uncontrollable seizures. Many drugs were tried. He eventually went through testing to see if he was a candidate for brain surgery, and he did have brain surgery, and he had 3 days seizure-free, after which the seizures came back with a vengeance. He was having over 50 grand mal seizures a month. And within 1 month of starting CBD-rich medicine, it went from 50 seizures down to 6 per month, which was a huge improvement. Now he was able to go back to school. But one of the interesting things post-surgery was that he developed this incredible rage. And he's a big teenager, and he just had the kind of rage where the parents were afraid of him. So we added in THC, and he's currently now using 2 products, high THC and then a high CBD product. When they're mixed in what fits him ends up being a 10-to-1 ratio. The rage is gone, his seizures are very well controlled, and he's back in school, and the family has some peace of mind. And so having these products available to be able to mix a little bit to create what works for that individual may be the answer for some people. If you try strain after strain after strain, it may be that one strain isn't going to do it. You may need to mix them, and you may need to mix high CBD with a high THC. Now, other anticonvulsants, and I put the reference at the bottom. It's a very nice review paper. CBDV has been investigated as an anticonvulsant. And it appears to have an additive effect when added with CBD. In California, for a period of time, there was a product that was being claimed to have a large amount of CBDV compared to other strains, and it turns out that it wasn't very much at all when it was tested. But certainly this is something that I'm hoping to see soon available to patients. THCA, which remember is the non-psychoactive, raw, unheated THC precursor, is not been readily available until the past year in California. You can actually get a THCA oil that is measured out, and We know that it works as a potent anti-inflammatory, and then there's not very much research, but anecdotally it's an anticonvulsant. I have some patients who have done very well with CBD, but not get full seizure control, and when we add in THCA, they have full seizure control. I have some patients who didn't respond to CBD, and we tried THCA, and it worked, and so now they're not on CBD, but they're on THCA. And so again, it's just another option for someone to try. The next three cannabinoids have been looked at. There's not a lot of studies on them, but they've been reviewed, and as you can see, the CBN, there's been conflicting results. With Delta 8 THC, there's some tolerance developed in the few studies that were done, and then THCV, it appears to be effective, but again, it's not readily available, so I'm not using it clinically. Now, this is the results from my practice. This is unpublished, but what I did was I surveyed a lot of my patients. At this point, I'm probably seeing over 400 pediatric patients with treatment-resistant epilepsy who've come for help. 201 patients responded. What I asked was that as long as they were on at least 3 months trial of oil, although the dosing changed, they weren't adding in other oils, and they weren't switching from strain to strain. They were staying consistent on one product. The average number of medications that they had tried prior to coming in to see me was 12, with a range of 2 all the way up to 22 different anti-epileptics. The average number of medications that they were on at the onset of adding CBD was 3, with a range of 0 to 7. Excuse me. I had a small percentage of patients that came in who were not on any anti-epileptics. And remember, the common other issues with many of these patients is that they have global delay, sometimes CP, autism, feeding difficulties, growth delay, precocious puberty, behavioral issues. So it's not just seizure disorder that we're treating. As you can see, the strains are, which I've mentioned, Charlotte's Web and ACDC, and these most common ratios. And then in my practice, what I saw was about 4% of patients actually did have worsening seizures. It's hard to know if that was because of drug interaction, but 2 out of the 8 actually were not on medication, other medications at the time. And so those 2 particular patients, it was hard to know exactly because CBD really shouldn't worsen their seizures, but in those 2 patients it did. About 6 of the patients had no response whatsoever, no positive, no negative. Now, what's interesting is about 28 patients, about 14%, had no reduction in number of seizures, but the parents reported that there was less severity and less duration, so they just didn't last as long. And remember, excuse me, when you're having a 2-minute seizure, it feels like 20 minutes, and so for a seizure to be reduced down to 14 seconds is something that the parents can absolutely deal with. They also saw these patients, they reported cognitive improvements. So when you're seeing less severity, less duration, and some improvement in your child's alertness and ability to interact with you, they were very happy with those results. And then I broke down the rest of the seizures. As you can see, 25 to 49% reduction, about 18% had 50 to 74% reduction of seizures, 37% had 75 to 99% reduction of seizures, and I had about a 13% seizure freedom rate. Over 68% of patients had greater than 50% reduction of seizures. Of the 27 seizure-free patients, 8 are now off medication, and out of this group, 40% were able to wean 1 or more medications. The only negative side effects we saw was drowsiness or diarrhea. And then positive side effects, I mean, the list is huge, but these are the more common things that parents reported on the survey: more alert, better mood, better sleep, more energy, better response to therapy, improved appetite, improved focus. One mom wrote, able to argue, which I thought was interesting because I guess her child prior was a little not alert enough to argue with her. And what they argued about, so cute, is the little girl never wanted to put her shoes on to go anywhere. So mom used to be able to just put them on her and they would go. No ER visits or hospitalizations. That one's big because that saves money, and that also saves time away from your family. And it's the number one thing a lot of the dads reported as beneficial, because remember, when mom's in the hospital with the child who's at home taking care of the rest, holding down the fort, so to speak, taking care of the rest of the family. Definitely less need for rescue medication. And I had 2 patients who also had type 1 diabetes who reported a more stable glucose when they added CBD to the regimen. In my practice, and again, I've been seeing patients now for probably pediatric patients for the last three years or so. We start patients at 1 milligram per kilo per day. I don't like starting at a high dose because the patients the parents are paying for this out of pocket, and for some patients, low dose works. There's no reason to start high and actually pass by the dose that actually might be effective. Sometimes I even start a little lower than that, depending. And I increase every couple of weeks as long as they're tolerating it well. The parents check in with me every 1 to 2 weeks, and the oil's given either orally, sublingual, or through the G-tube. The average dose, as you can see, it's quite a range because everybody's different and everybody responds to a different dose, but 5 to 12 milligrams per kilo per day is about where I see success. If someone's not responding, we can change strains, we can change the CBD to THC ratio. This is why multiple products should be available, not just 2 products. I was asked to consult for a company looking for a license in New York State. There are going to be 5 products available. How the heck are we going to help people when there's only 5 products available? That's just not going to work. Now it's interesting, there appears to be no tolerance to CBD. Once you find the dose, it seems to be the dose that works. Patients do not seem to need much higher doses unless they're growing, gaining weight, or if there's some other variable to play here. Again, if we sometimes are weaning off other drugs, we may go up on CBD, but invariably we end up going back down. There's a phenomenon that's been described as CBD saturation, not in the scientific literature, but kind of in the cannabis world. It appears that sometimes if a patient has been on CBD at a higher dose, or what's considered a high dose for that patient for quite some time, anywhere 6 months, 9 months, a year, sometimes what will happen is the child will start seizing, having more frequency of seizures, and there's nothing else to blame it on. Nothing's been weaned. The child's not sick. Nothing else has changed. And sometimes in looking back on the history, I'll see that the child has been on that particular dose for quite some time. And it's interesting, what we end up doing is we end up skipping a handful of doses, anywhere from 1 to 3 days of doses, and then we restart at a lower dose. And those patients do great. I've done this probably in about somewhere between 25 and 30 patients now, and only 1 child didn't respond. Everybody else, the seizures, they went back to very few seizures, and we were able to readjust the dose to a lower level. I don't know why that happens. Some people describe that there's just, they just don't need as much, and maybe the fat is being saturated. It's hard to know exactly what's going on there. Now, for many patients, I encourage them to have their drug levels checked to make sure, especially if something's happening, if they're having more seizures after we go up on dose or we get up to a higher dose. Since I do not prescribe anti-epileptics, I'm not a neurologist, I'm helping patients with their cannabis. I try to work in conjunction with the neurologist to have levels checked, or encourage patients to get the levels checked with their neurologist. THCA oil is always an option, as I mentioned earlier. And then if I'm finding that CBD doesn't work, also I forgot to put on here, we'll add in THC to help with weaning, and also sometimes just to lower the ratio, which will work for some patients. And then in California, cost is an issue. I have patients spending as little as maybe $125 to $250 a month, and I have other families that are already at $750 a month or something like that. So that's very hard to sustain out of pocket when you have other costs with children with special needs. And so certainly it would be nice, especially if someone, you're getting a good response, you're staying out of the hospital and getting off of drugs. I really believe insurance should help pay for this. Now, thank you. I see a fair amount of patients with autism, and remember, the main issues for these patients are communication, repetitive behavior, and really the big thing for many patients is social challenges, the anxiety, the tantrums, and this self-injurious behavior, and maybe even harm to others. We know that the endocannabinoid system regulates emotional responses, and anxiety, behavioral, social interaction, immune system, and all of these are aspects of autism. There's only been a few preliminary studies in animals, but there is apparently we're showing some genetic mutations associated with autism that also are resulting in some endocannabinoid dysfunction. Human study, there was one human study where, we don't want to take brain tissue, as Dr. Russo said, but you can draw white blood cell levels, just draw blood on a child, and they were able to check children with autism versus children who did not. The children with autism had an abnormality in the number of receptors that they had on their white blood cells, because that's where those receptors are expressed. There are many anecdotal reports of children with autism responding to both CBD and THC, and sometimes combination. I surveyed 27 patients, families of 27 patients with autism aged between 3 years and 18 years. And these patients all started on high CBD to THC. About 15% actually got more agitated. I do find that CBD can be overstimulating for some patients. Remember, CBD in lower doses can be what we call alerting. Like, it doesn't make you sleepy, but some people actually feel a little bit more energy on it. And in higher doses can be sedating. And it appears that for some of these kids, right when we started at low dose, they actually became more agitated. And as we went up, it did appear to help a little bit. Some patients just had no response. And then I had about 63% where the parents did report calmer behavior, reduced or eliminated self-injurious behavior, improved communication, improved focus, improved reports from therapists and teachers. Many of my families who start cannabis do not tell the therapists or teachers that their kids are going to start oil, because it's an unbiased report. And so remember, with parents, you may be seeing things and you're not sure, is that a positive? Is my child acting better? You have 4 nights of sleep that are better. Okay, does that count? But teachers and therapists will tell you there's something different about your child. I notice that your child is paying attention, able to focus, is participating in therapy. And so I'm not telling families to not tell people. I just say in the beginning, don't say anything and see if you get some type of unbiased response back. For autism patients, I found dosing is lower than epilepsy patients. They just don't need as much, and it can be anywhere from 1 to 3 times a day. Although I do have one child who's doing phenomenally well on a combination of CBD and THC, although the parents have actually said to me they can see the oil wearing off at the 3-hour mark. And so his behavior goes from he's doing great to he becomes self-injurious. In fact, that mom came in covered in black and blue marks, and that's why she was seeking help. But that boy's done well, and they just give him his dose every 3 hours. It works, and she asks, is there something wrong with him that he needs it like that? But that's his metabolism. Popular strains that are being used by my patients are Harlequin, Canatonic, ACDC, and Charlotte's Web for autism. And then, like I said, high CBD to THC can be too stimulating, and by lowering the ratio, sometimes we can balance it out for those patients. Here's a case report of a 10-year-old girl with autism. She had severe self-injurious behavior. She was nonverbal, significant anxiety, and these are quotes from the parents when they came in. She's not learning anything from therapy, and we're prisoners in our own home. We don't go anywhere. And I have to tell you that the dad spent the entire visit just kind of trying to corral her, because she was touching everything. She tried to open the door. She was under the examining table on top of it. It was exhausting just watching the dad doing that, and that's what he does 24/7. We started her on whole plant CBD oil, high ratio, and it was just too stimulating. And remember too, she does go to school during the day. And so what we decided to do at that point, when they told me it just, actually made her a little bit more aggressive, we just decided to give her a little THC at nighttime to see what that would happen. And lo and behold, she had less anxiety, less self-injurious behavior. She stayed in bed. She normally wandered the house. They would find her in all different rooms. And her sleep was improved. So that was the beginning. And then slowly what we did on the weekends when she was home and they could observe what was going on is we added in a little THC, and we just kind of played this game where it's a little CBD, a little THC, just to find the balance. And You can see her combination there, 5 milligrams of CBD plus 3 milligrams of THC. And the dad sent me an email, and it basically low behaviors, low anxiety, less fixating. Her ABA therapists are seeing good days and good behaviors and no evidence of psychoactivity at all. And overall, this family has said that their quality of life is tremendously improved. And these are very low doses, very affordable. Pediatric cancer, I'll go through it real quick. As you know, it can treat symptoms, but remember too, cannabinoids have been shown to actually inhibit tumor growth, cause cancer cells to commit suicide, inhibit metastasis, inhibit angiogenesis, and recent literature has shown with some chemotherapy there is some synergism with cannabis and chemotherapy to actually enhance cancer killing. And so, you know, the majority of my patients that are coming to me, many of them are just patients looking for help with side effects, but seeing a very increased influx of patients with advanced cancers who've exhausted most options, who either have treatment failure or chemotoxicity, and they're ready to try something else. And remember, it's been in the news, and there's much more media exposure, so patients are reaching out. I use combination high dose CBD and THC. We don't know the doses. We don't have research. There's not one human study using THC or CBD together for treating cancer. There is a published case report, and as you can see on these graphs, this was a young lady in Canada who had a very difficult course. I think she fought cancer for 34 months and still was sent home with hospice, and her family decided to try cannabis. She had a rare form of ALL, acute lymphoblastic leukemia, with a very aggressive chromosomal mutation. And as you can see on these graphs, on the left side shows how many blasts, which are the leukemia cells, and it shows, if you'll notice, the first 5 days of oil treatment, it actually climbed, and then it started dropping as they gave more oil. And really what's interesting is that on day 5, they gave her enough where she felt euphoric and actually a little out of it, and she got very hungry. And so they knew it was in her system at a dose that she felt, and that's when the leukemia cells started to drop. As you can see in the second graph on the right, it started climbing again. Well, that was with a new syringe of oil, and remember, these were untested syringes at the time. They didn't have testing ability, so they just had used one syringe, and then they moved to another one, and it was concentrated oil, but they had no idea how many milligrams she was getting, and they just decided to titrate up to a dose where they would see the blasts fall, and as you can see, it basically plummeted down. What this particular case report shows is that it demonstrated disease control, meaning it basically eliminated her leukemia in a dose response curve. As the oil went up, the leukemia cells went down, and not only once and not only twice, but another time as well. So, and this was in a child who was not receiving any other treatment and certainly was not getting spontaneous regression because she was a terminal patient. This is my case report, and I'll end after this, okay? I have a 16-year-old boy, now turned 17 just recently in my practice, who came to me with stage 4 osteosarcoma. He came a year ago, April, after 2 years of intensive chemo. He had over 10 surgeries. He was given 90 days to live. The oncologist in this particular case was open to using cannabis, and she sent him to me to see if it would just help with his end of life. What's interesting is he was still on what we call palliative chemo. They didn't want to withdraw chemo because it's very hard to do in a child who, you just you don't want to call it quits. And so he was on a drug called gemcitabine, and it just so happens in the literature there's some evidence that gemcitabine plus cannabinoids triggers some synergy, so increased cancer killing. And so I explained to the parents that we don't have any studies. We have lots of animal studies and in vitro studies, but do they want to go for it? And of course they said yes. And so we started him on low dose concentrated THC and CBD, and I told them to increase it over a 1 to 2 month period. They went way faster than I would have gone, but they got him up to very high doses, 500 milligrams of each, to equal 1,000 milligram of cannabinoid a day. And that was April. In July, he had 4 scans, MRI, bone scan, CAT scan, and PET scan, showed no evidence of disease. And this was a child that came to me with innumerable tumors in his lungs, in his vertebra, and in the primary site, which was his left leg. Yeah, it's awesome results. What's interesting is after the cancer, he showed no evidence of cancer. He developed really bad anxiety. We don't know if it was the THC or that look, teenagers know what's going on. If he just got really anxious, at first he thought he was dying and now he's not. A big emotional roller coaster for a teenager. But we decreased the THC dose because it's a very high dose to sustain. As of April, I just saw him a few weeks ago. He had scans in November and scans at the end of March. He still shows no evidence of cancer. He continues on, you can see pretty high dose CBD and a lower dose of THC, and his chemo was actually stopped 2 months ago, so we'll really see what happens now. And then I just wanted to show this. I love these pictures. So his mom sent me these pictures. So that was after a particularly nasty surgery. They had to go into the vertebra because the tumor was impeding on his spinal cord. And they actually had to cut the surgery short because they were afraid they were going to paralyze him. And then that's him at Halloween. He wasn't supposed to be here at Halloween. So good for AJ. And I don't have time to go over, but hopefully this will be made available to you for psychiatric and the pandas. The product requirements, this is what I basically found. You want concentrated oil so that patients can take small amounts without having to take a large amount of oil. Consistent in strain. When somebody finds a strain that works, the last thing you want to find out is that you go to your supplier and they say, oh, we don't have that one anymore. Sorry, you have to start over. Especially in pediatric patients, if they're doing well, a change in strain can actually wreak havoc and they can start having seizures again. Certainly laboratory tested goes without saying. Affordable is a big issue. I have seen oil as cheap as 5 cents, and then I say 35 cents here per milligram, but I've even seen recently over $1 a milligram. If you're taking 300 milligrams a day, that is not sustainable. That cannot, nobody has that money to be able to do that. And then a reliable supply. The last thing you want to find out again is that somebody sold your oil to, the supplier sold it to a different family or a new patient, and when you go to pick it up, they say, sorry, it's, we have to wait for the next harvest. So especially if you've weaned off medication, now you're leaving a child in a situation where they're off medication, you certainly want to make sure your supplier has medicine. And then this is just to review the overall approach. Pediatric patients, I do start with low doses, usually high CBD to low THC. And for CBD dosing in general, it's higher for cancer and epilepsy and most other conditions. It's on the lower side. THC dosing is start very low dosing. We can add it in or use it separately. It makes it easy when they're in 2 separate bottles. And then often, consider changing strain or the ratio if it's not, you're not responding. And also, I didn't put on there you can also consider adding THCA. In my adult patients, I go through again, are they new to this or experienced? The methods of delivery, I educate them about CBD and THC, and then I just break it down into 3 categories so they have an idea of where to go when they're getting their medication and where to start. And then there's a bunch of my kids that I take care of that I'm in love with. So thank you very much.
Thank you very much for that, Bonnie.